This is ASAP Pathway. Hi, ASAPer friends. I'm just so excited. I'm so excited about our podcast today and our guest. And we actually were talking for quite a bit beforehand, and I've just gotten to know our guest today even that much more, and I'm just that much more of a fan of Dr. Sandra Kahn. Welcome.
Thank you.
I want to, your bio, I just was saying before I hit record, I don't know even what to leave out. I usually abbreviate it a little bit for time, and it's so dang good. I don't even know what to leave out. So you're like, just introduce me and let's start talking because you're just this amazing disruptor for good in the community of, dental facial and craniofacial orthopedics and function health. And you're just so accomplished, and everybody's got to know who you are, um, and what you're doing to change lives. And I think for the listener today, there's some stuff we're going to dive into, even on a personal family level today. So I hope you stay tuned for the whole podcast because I think a lot of what you've been through, Sandra, and I've been through, a lot of people are going through right now. And I think this is a necessary conversation. So I'm going to do kind of an abbreviated introduction of you, and then we're going to dive in. So, Dr. Sandra Kahn, she is a recognized leader in craniofacial growth and development, airway efficiency, athletic performance, and early life feeding physiology. She is a diplomate of the American Board of Orthodontics. Her career includes extensive academic and clinical collaboration with institutions such as UNAM, CES, UC Berkeley, UCSF, and Stanford, where she's conducted clinical work and research in anthropology, evolutionary biology, orthodontics, sleep medicine, and infant feeding development. She's pioneered science-based approaches to airway training, nasal breathing, optimal oral posture, and physiologic feeding mechanics. She's the inventor of NutriFlow and Pacific Flow. She is also innovative infant feeding and soothing systems designed to support natural swallowing, jaw development, and nasal breathing from birth. She holds 9 patents for devices that improve facial growth, promote relaxed resting posture, support physiologic swallowing, optimize sleep quality, and enhance athletic recovery. Her bio goes on because she's written I guess 7 books now. And I have some of these books in my practice. Jaws, which is the story of a hidden epidemic. Also GoPex, which is about oral posture exercises. I have that in my practice that I show my patients. You have created Forwardontics. You just published an article with Dr. David Gazal and also Claudia Restrepo. Is it Restrepo?
Restrepo.
And
Tremendous pediatric dentist and
oh,
neuroscientist.
so you got a pediatric dentist, neuroscientist, you have an orthodontist, and a sleep physician that put this paper together, and it includes the up locker. And I'm like, what on earth is this thing? So I've been in contact with you over the years. I've watched you develop amazing reverse pull face masks, the face bow. I've just been a fan of yours for many reasons. And then this paper comes out. This is a recent paper. I'll put it in the podcast so everybody can go look this paper up. It's called The Impact of Palatal Expansion with Uplocker on Children with Sleep Disordered Breathing, a Clinical Trial. This is a 2026 release. This is a new paper. So I just want to jump in. You're an orthodontist. You're not like most orthodontists. What happened on your journey, Sandra, that said, I am going a totally different direction? What is your story?
Well, I'm a woman. I'm a mom before anything else. And and really, my journey is in my books. Since 2013, I wrote the first book, Let's Face It, and it was a story of everything that I was finding out, and I was frustrated knowing so much and not being able to make, a clear roadmap for my children. And I knew that what I was doing orthodontically was not going to help, especially my son, who was a mouth breather and wasn't growing properly. And fortunately, he didn't have a malocclusion. So I knew that that was not where the problem was. And my friend Barry Raphael, he pointed me towards John Mew, and he says, you gotta, learn a little bit. So I basically just threw everything to get my firstborn right. And I dedicated the next 10 years to getting my children right. And I just went through everything that worked and everything that didn't work. And, I have those 9 patents. It sounds like a lot, but I just kept making things, creating things that I needed because what was there wasn't helping me. I wasn't trying to become anything specific. I was just trying to help myself. And because things were not available, I created them. And then I create the books because I really think people need to take charge and have things and learn them. And then what happens is what worked or you thought it worked, it didn't work. So I need to move on to the next book to explain the new thing that's working. And it's a trial and error, but I think now 2026, I've really found the not necessarily the cause because I'm a very curious researcher where I want to find where the problem is and then make things right at the very root of the problem. I don't want to be dealing with symptoms. And I think I finally, touched it because I was looking for so many things and in my path. And I'm not a religious person, but I'm a believer that there's something that's guiding my path.
Yeah.
And I don't know if it's my father from heaven that's just, manipulating what I do because I have one child with an open mouth, a second child that has never had her lips apart, but her malocclusion was so bad, but it fell through the radar because her mouth wasn't open and she was healthy. And I saw, at 15, she wanted to have a nose job and I knew her jaws were back. And so I needed to figure out what happened with her. So I had the two extremes in my two children. And I was very fortunate because their personalities allowed me to really work with them. And I had so much obsession and I made so many mistakes that my calling is to help, you know, find a little bit of order in this
Mm,
chaos and
mm.
give a easier path to people. I was talking to you about Valentin Fuster, who talks about promotion of health. He says, don't talk about prevention, talk about promotion. And Dr. Ronhell, who's my ENT now that I work with, he says the nose just needs conditions. You don't need to work hard or learn anything. Health doesn't need to learn things. It just needs the conditions to be right for health to flourish.
Well, it knows what to do. Well, the
Yeah,
nose knows. I mean, the
yeah,
nose knows what to
yeah,
do. The body knows what to do to be healthy. We just need to get out of its way. And
exactly.
something you said before we hit record too, you said my message really after everything I've been through as a mother, as a practitioner, as a woman, which that's what, I think our kindred sisterhood here, right? We're moms, we're women, and that whole thing about mama bear is a very real thing, like if you feel like your kids, something's being missed, moms will do pretty much anything, move mountains, do what they can to help their kids. But, you know, in the process, it can be overwhelming. There's so much information out there, Sandra. I truly feel for parents. I truly feel for families because they're all seeing this epidemic. They're seeing it too. They're trying to put their finger on what it is and then how to help. And you start going on chat and Google, and it can be paralyzing, and then it can be divisive in the family. And all you're wanting to do is help your kiddos. And so what you had said earlier, and I love this, you said, after everything I've been through, I just feel like I want everyone to know less is more. Let's find a way to maybe it can be so simple, yet it's not easy, right? It sometimes that's the case. But you were talking about Dr. Valentine, the cardiologist at Mount Sinai,
Mhm.
Fuster, Fuster. Let's talk about promotion, not prevention. Dive into that a little bit more. What does he mean by that?
Well, he means when you talk about prevention, it's negative because you are saying this disease is coming your way and we're going to do something to keep the disease from hitting you.
Got
And
it.
it's very, prevention is very specific, where promotion is it's more general. Just make sure you're in the parasympathetic mode so that your cells are protected, so you're sleeping well, and so we're not specifically uh, going to keep you from getting diabetes or getting a specific disease. We are going to just create an environment where your cells at night are recovering properly. So whatever comes the next day, they can deal with it. And then let's get you resting properly so that your brain is disconnected fully. And this is the work that we've been doing with Dr. Gozal and Dr. Restrepo, which is amazing, is getting this, our paper, which you touched on it a little bit, and I'm kind of jumping all over the place, but the paper really has helped me put everything together. It was the one piece because the thing that makes this paper seminal all over the world, and everybody should really be talking about this paper. It should even be going on Nature journal, because what happened is deep sleep exploded through this posture, and deep sleep is where health happens. And a lot of kids, like Dr. Ron Hell, who's a ENT neurologist, also pediatric ENT, he says he has kids that I've sent him that get zero deep sleep. Stage 3 non-REM, zero. How can these kids, be protected during the day? When you are in deep sleep, your brain is disconnected and your brain can clean itself, can integrate memories, it can integrate emotions. So deep sleep is where the nirvana is and what we need to get to. What we do during the day doesn't matter. This is where John Mew was such a genius, because I don't know if you know the tropic premise that he talked about.
I don't go into that because I'm sure most listeners don't. I have so
So
much
John
respect for
Muir
John
showed
Mew.
amazing cases in his photographs. This is why I moved basically to Europe to learn from him. And in his tropic premise, he said how the resting position should be for health. And he said we need to have our tongue on the roof of our mouth, the lips closed without any effort, and the tongue completely touching the palate. And then he keeps going and says 4 to 8 hours a day. And, at the time, I was yelling at my kid to close his mouth every minute of the day. And my kid is really smart. And he was very young. He said to his sister, don't worry about closing your mouth because Dr. Mew said only 4 to 8 hours a day.
He
So
was
I went
listening.
to Dr. Mew and I said, John, why did you put 4 hours a day? Now my kid says I shouldn't tell him to close his mouth 4 to 8 hours a day. And he completely blew my mind when he said, Sandra, your kid is absolutely right. If he can keep this position for the time that he's sleeping, which for any given human is 4 to 8 hours, he will grow fine. You only need the resting time to be completely what Dr. Engel calls relaxed rest. So your brain is disconnected completely. Your frontal cortex is not needed to help you breathe. You don't have movement. You're like paralyzed. And if that is correct, then everything else in your life will flourish. And I thought, when you go back and you find things that are brilliant that you missed. And
Yes.
almost everybody that works with the tropic premise misses this part of the dimension of time and when that position should be. So Some people have their mouth open, but their jaws are fine. Some people eat very soft food. I looked into this community in India where they eat nothing but like, you know, mushy foods. And some people have their jaw is perfect. And I'm like, how is it this possible? Because they're getting their teeth together and their tongue in the roof of the palate and their nose breathing without any effort for those sleeping hours. They're getting into deep sleep. And if somebody
During that deep stage 3 sleep, that is when growth happens. We know that growth hormone is released during that time. So it's like, okay, the growth of the craniofacial complex, right? The that so what they're saying is, I guess, that even though they're eating mushy foods, okay, let's talk about that a little bit because we're promoting, hey, we want hard, firm, crunchy, veggies don't have facial atrophy. We want you chew, chew, chew. Look at these cultures that chew their food. But you're saying there's this culture where they just eat nothing but mushy food and their faces are beautiful. And it's like, oh, that's interesting. So, but what is happening for them? They have nasal breathing, good resting posture, lip seal, deep, good sleep architecture. Good sleep architecture that is driving good growth. Whereas we've got an epidemic of children for reasons we're still trying to figure out, gut health, preservatives in food, allergens, environmental problems, whatever, poor sleep. And you said something earlier about sleep architecture and the flushing of the brain. I mean, it's a recent science
Yeah,
knowing
the glial
the
lymphatic
glial lymphatic, yeah, the glymphatic system,
is very new. We
very
didn't
new.
know
And
about
so for the listener, the glymphatics, you've heard of lymphatics, right? Drainage into the lymphatic system. If you watch Instagram or TikTok enough, you see all these girls like rubbing their faces to get the lymphatics working and sculpt their faces. There's even research that that's helping the brain. It's a beautiful thing for your face, but it's helping the brain because you're getting those toxins into those lymph nodes to pump. But the brain has a pumping system. And we're seeing a rise in dementia and all these other issues of basically the clogged glymphatic system. It's not cleansing itself, it's sticky. Um, and what is causing that? Well, we know that that glymphatic system is active, very active during certain stages of sleep architecture. And we just, as a world, our sleep is just getting worse and worse and worse. And it's interesting. I was testing my own sleep the other night with a new sleep device. I'm like, ooh, let me guinea pig myself. And my sympathetic tone was ridiculous all night long. And I thought, how do I get into better parasympathetic in my sleep? But back to what you're saying, this growth and development is, you're saying, more connected potentially to our sleep architecture versus what we're doing during the day necessarily. I mean, what we want, ideally, we want this beautiful 24/7 awesome oral rest posture, but you're saying what's super, super important, if you're going to pick a time frame, if you're going to pick 4 to 8 hours, let it be the 4 to 8 hours that you're sleeping versus 4 to 8 hours during the day. Is that what you're saying?
Well, it's not pick those. It's what to do when you're doing nothing. You got to disconnect for the brain to do its job. If you're asking the brain to do something, then the brain cannot do what it's meant to be doing. So it's about disconnecting. And, I'm not saying what we do during the day is not critical, chewing properly and it,
Okay.
but what I'm saying is the most important, the hierarchy of functions, the disconnection of the brain is very, very important. And we are not getting there. We're not teaching our kids how to do it. We are just on the go, go, go
What
all
does
the time.
disconnect? Explain what you're meaning by it's important for the brain to disconnect in order for it to heal and fix and repair. What does that
Yeah.
mean?
Yeah, in our nose book, we really dived into the nitric oxide part of it, which every time I start diving into something in my anthropology graduate work that I did and my work with Dr. Paul Ehrlich helped me because in physical anthropology, you're trying to solve a puzzle by just observing what you can see. And this puzzle is just telling me, what's going on with nitric oxide. And every time I looked into something and I get surprised, I like, okay, that makes sense, but nobody's seeing it that way. And when you look at the what we know as a fact, like with nitric oxide, we know how important it is. And everybody says when you breathe through your nose, you get more nitric oxide. But then I talk to a physiologist and says, look, where is nitric oxide made? In the endothelium. And we have in our mouth. So the nose and the mouth make equal amounts. If not, the mouth makes more nitric oxide. So you go like, okay, how do I put this together with the nitric oxide? And then I keep looking into it. And then Dr. Rangel, a neurologist, he says, Sandra, the key is that the nitric oxide and Dr. Nathan Bryan, also he's an expert in nitric oxide, they explained to me, it's not the amount, it's the bioavailability of nitric oxide. When you breathe through your nose, and when the nose acts like a natural injector of air. If you look at the shape of the nose, it's a big cavity that drains into smaller ones, like when you take your garden hose and you put your thumb, you inject the water
Ah,
away.
yes, the force.
So if
Yeah,
your nose is working properly, then your muscles, your chest is not going to have to pump to get the air in. If your mouth is closed and your nose is working without any effort, then your brain can say, okay, everything here is fine. I can go clean. I can go start my lymphatic. And the nitric oxide, what it does, it dilates. So it dilates the vessels that go to the heart if you need muscle work. And if you don't need any muscle work, then it dilates the lymphatic pathways. So it's like one or the other, like a seesaw. If you're using it here, you can't use it here. But if this says, okay, brain, I don't need any electricity, the brain is not asking me for anything, then I can drain. Just like with the kids, we say, look, if you're cleaning a city, you got to clean it at night when everybody's gone. You can't clean it in the middle of a party, right? If you have
right.
a parade, you can't clean. You got to clean when everybody goes to sleep and nobody's asking to use anything. So the brain needs to be completely not requested or not requiring, because the moment you require something from the brain, you recruit the brain to do something. So you want that brain to be disconnected, you want to be paralyzed, and that's when the brain and the gliolymphatic system will clean your brain, preventing, that amylase plaques from
Yes.
that cause Alzheimer's, memory. But in children, you help the children, in the biggest thing that the brain can do when it's disconnected is integrate emotions. This is why kids, they're doing well in school, they're athletic, they're growing in height, they're doing all these things, but maybe they're not able to um, um, hold their emotions as well as if they were getting good rest. So the emotional part, the memory integration, there's things that we do at night, and we need a clear nose. We need zero effort in our body to go into what you were calling the parasympathetic, which provides that environment where your cells are protected and your brain is doing its cleaning. The moment we struggle a little bit with our breathing, or we open our mouth, or we have, resistance in the nose. This is where my nasometer is great because you can measure at home how it's not exact resistance, but you can know how much pressure your nose is doing. That's why I stopped recommending the taping of the lips, because we found that when you tape the lips, you create more resistance. So your brain has to work harder. So you don't want that. So there's all these things you can do to promote this deep sleep, which is paralyzed. If you look at somebody
Mm.
breathing or sleeping, you don't want to see their chest going up and down, especially a child. You want them to be paralyzed as many hours. And deep sleep, we don't need 8 hours, but we do need a solid 1 or 2 hours of stage 3 sleep. And that's when the nitric oxide is bioavailable to the brain. So, all that just to say that it's really about that deep sleep that's we're missing out in this health epidemic. It's that deep sleep. And
It
there's a lot of
is. It's not
amazing
just
stories.
kids, it's
Yeah.
adults too. I mean, you're seeing so much research coming out, Sandra, on the deep sleep being lacking. And, you know, what we used to see in 80, 90 plus year old people, we are seeing now in 50, 60, 70-year old people. It's like dementia is everything's just scooting down a lot earlier in life. But in children that don't sleep well and don't have good sleep architecture, we know that there's issues with executive function, behavior issues, but growth and development, that is when, for children, that's how they grow. For adults, it's how we repair. Um, so you got children that are maybe smaller. They aren't where they should be in the percentile, maybe with their growth and development. But I want to dive into this paper a little bit more, like the details, like what is unique, because everybody's talking, there's the focus is so much on AHI, apnea hypopnea index. Can intervening in early orthodontic, early interception, can we really make a difference? Because a lot of the ortho community says there's no point in intervening early. We just are going to wait till they're a little older and then we can correct some things then. There's no point in correcting early. They'll say, look, it doesn't get rid of apnea. It doesn't get rid of all these different things. Whereas you'll see papers from, Guilleminault from Stanford that expansion, myofunctional therapy, tonsillar adenoid removal provided the longest kind of reprieve from obstructive sleep apnea for children. So there are both sides will throw papers at you and say, someone's going to find a paper to support what they believe, right? But the reality is what a lot of us are seeing with early orthodontic intervention is maybe not necessarily even able to be objectively measured right now. Some of it is we are just anecdotally seeing so many changes with kids. The problem is how do we sustain this? If you see some changes, maybe they have allergy testing, you remove the ENT gets in there with allergy testing, or maybe tonsils and adenoids are removed from viral load hanging out in these tissues that have caused them to be enlarged. We get that removed. We remove that obstacle from the body so it can be a little healthier. We help develop the jaws. We get dental facial, craniofacial orthopedics involved. We create these beautiful faces. We create bigger airways. With all of these anatomical changes, we are seeing different kids. But then what happens sometimes is that's the honeymoon period and it's not sustainable. You see changes that are not sustainable. And I think that is a very fair assessment of what a lot of practitioners might. It's not that it's not necessary developing the jaws, removing obstacles early so children can have a better palatal vault for their tongue to live, removing nasal obstruction so a child can breathe better through their nose. But something's missing, is what you're saying. There's something missing to help with sleep architecture, sustainability, and more long-term health and wellness for these kids. Is that a fair assessment? How can I say that better? There's something you
No,
feel
no,
that's
this is what we were talking about. And the uplock that I learned from Dr. Engelke is the way to maintain that negative suction in your mouth without any effort. And my beautiful colleague, PT Jennifer Hobson, she coined the term invisible swallow. And
ooh,
I observe everyone, and this is part of GOPEX, but she used that word, which is very descriptive. And so we're teaching children to do the invisible swallow because I see everyone, I see myself on screen now, I see you, and we all swallow using our facial muscles. So in order to disconnect that and hold that relaxed tongue with no effort, we need to have that dynamic of fluids, which is a little bit of suction, very mild suction. And this is what we teach with the uplock. So you swallow, you recognize there's no air inside your mouth, no empty space, and then you hold it, but minimally, so it doesn't separate. And that is, it's like a superficial tension that holds inside your mouth. And we're supposed to have that naturally. My paper in bioscience, which was the most cited paper in 2023, and it's given the definitive opinion on malocclusion. And really, we worked with the top scientists in the planet, and we basically proven or given the opinion that malocclusion and this shrinkage of the jaws is not genetic, it's environmental. So if we can create this environment that has that little suction for the sleeping time, then we will be able to grow properly. So what we do is we teach these children. We have this we're putting together, I'm very excited, a retreat for families in a beautiful resort in nature. And we are only going to take 20 families, so we can teach children how to do that in a community. Because being an anthropologist, I know we learn better in community. If a child sees another child doing this, child helps the other one, and it just becomes a positive situation, as opposed to a parent just grinding down, close your mouth, close your mouth. That's not conducive to good. I always say, it's forbidden for any parent to tell a child to close his mouth, because opening the mouth is not a choice. It's a protective plan B of the body when the nose is being bombarded with all kinds of things. So a child's never going to close his mouth by telling them, but we can create these practices and improve the situation so that it happens organically. And I'm very lucky to have a pediatric dentist in Chile. She's brilliant, Contimena, and she had a baby in September. And so through her baby, she had two older kids where she struggled 5 years with myofunctional therapy and not being able to help her older child, her second child having issues, and everything is a mess. And then she's pregnant. I meet her. She says, "You got to help me with this new baby." This baby was born in September, and this is baby zero. I'm so excited because we created the NutriFlow, which is the most amazing bottle, baby bottle, and the Passiflow. She's been using it with her child. And she tells me every day, my two children, they used to slobber a lot. We used to have, the bibs and all this. And she says, my baby doesn't slobber at all. And his mouth is closed. He's either laughing or breastfeeding, or his mouth is solidly closed. And she has done nothing other than breastfeed and use the Passiflow and the NutriFlow.
So the NutriFlow is a bottle system, you're saying that is it creating this negative invisible swallow, if you will?
It
From
doesn't create it. It just fosters that natural reflex that we have as humans. And now my kid says, my son says, "Mom, you're obsessed with throwing down your theories." And I said, "Yeah, because if I see that it doesn't work, then I have to come up with a new one." And my new theory is that these bottles, because even kids that are breastfeed exclusively, they get given water, or there's a point where we put something solid between their tongue and the roof of the mouth. And that it's an obstacle for the tongue to get to it. So the Passiflow and the NutriFlow actually collapse. They're very thin, so they allow the tongue to do what the tongue would do naturally if we were living in cave times. So this baby is giving me all this information. And when I'm using the uplock, which is this negative suction, which your audience can do right now, you put your teeth together, lightly you swallow, and you recognize no air inside your mouth. And that just stays closed hermetically by, dynamics of fluids or the suction. And then you can hold that position for long periods and it becomes mechanical. So when you go to sleep, that position is like the where your tongue parks itself. And then your nose becomes a natural injector if you have that suction. I mean, I have people, like I had a student the other day, and she came over, it was a 2-day course, and she came over in the second day. She says, Dr. Kahn, and she lifted her shirt and showed me she had 3 surgeries, scars. And she says, I've had reflux surgery
Oof.
3 times. And last night I slept with a lip locker. And it's the first time in my adult life that I remember waking up without acid. And I was like, oh my God, yeah, because it's a pressure thing. And the reflux, it's a pressure thing. When your mouth is open, your lungs have to create more pressure to get the air down. So the valve opens up, letting the acid out. So it's a pressure. So I get surprised by all these things that I'm learning, slobbering in the baby, or acid in somebody that has chronic reflux, or ear infections. Ear infections, they're a pressure problem. So if you hold this suction in your mouth, your ear canal drains, no more ear infections. There's so many things that this uplock position facilitates what Fuster talks about, this promotion of health, of all these things that are just a result of having the wrong pressure in our mouth. Even if our lips are closed, if our tongue is down, there's air in there, we have, positive pressure. Negative pressure is a little bit of suction. We can measure it. We can hold it. It's been published for 150 years. We know the pressure inside the mouth is minus 10 to 15 millibars, which is super minute, but it's been measured. So we can measure it with a manometer and practice it. Practice this invisible swallow and then just finishing in that position. And that's exactly what you were talking about. All these techniques that come in and go, and we say early treatment, early expansion, good, bad. It's good, but we're not maintaining it. Kids are going to have their ears, put ear tubes to drain their ears, or they're going to any ENT that works on a kid, tonsils, adenoids, reduction of turbinates, all these surgeries, they need their rehab, they need their maintenance after the surgery, and then they will be successful. We think things are not needed, like early expansion, early treatment, because we do it, it looks great. You talked about the honeymoon period, but then the problem comes back. Why? Because we don't do the rehab, and the rehab should be something natural for our species. So I'm excited to do this workshops with families. My big priority is to foster and maintain the bond between families, because this creates a lot of anxiety, and anxiety is not positive. So if
No,
we create
correct.
this change and understand that this is something that's natural for us, when something's natural, it shouldn't be hard work. It should come naturally. And when we practice it, it becomes mechanical, automatic. And I'm very, very excited because I now work, Dr. Restrepo here, neuroscientist, pediatric dentist. She talks about, in utero, tryptophan and serotonin. There's things that you can do in utero so that your baby's prepared to hold this position when your baby is born. Because babies are born weak, the lip reflex is not strong when we're born, and we can help these babies when they're born breathe better, and then foster those few or their first 1,000 days, so that this is downhill and they never ever have to think about this. So if I get my hands on 1,000 days, and 1,000 days is not 3 years, because it includes gestation.
I was just going to go there. So that first 1,000 days of life, not after birth, first 1,000 days of since conception, I guess. So it's like you've got this, there's so much in the intrauterine environment that we just do not even understand that's affecting the health too. I mean, we're still learning so much. But you're saying there are things that, and Dr. Restrepo was saying this about tryptophan and serotonin. So the mother, once again, us moms, um, the mother could be doing things to provide more tryptophan and serotonin to her baby in utero that is going to nurture this kind of invisible swallow, kind of that negative pressure hold in the mouth. So does she have anything being published on this, or how do people learn more about that?
There's a lot of information on this. My student pediatric dentist, Dr. Mena, who was pregnant, we knew all this, so I'm a champion for women. I'm so skewed. We were talking about this before,
Yeah.
but her husband scheduled, you know, massage days for her, and just knowing that this is important for your baby, for your mom, for the mom to not be stressed and to be happy. The happiness, the hormones are serotonin, so we can do so much to get the mom prepared to help this baby have the ability to create the uplock as early as possible. So there's tryptophan, serotonin. There's a lot of neuroscience published on that. But now we're bringing it. Shows like yours are a treasure because anybody can listen to this. You don't have to go in and listen to the science, but you have to, inform these mothers and their partners. And we have to protect the bonds within families. It's so critical in this, crazy world. There's so much, information, and everybody's on mobile devices, and children are wanting these phones, and we're giving dopamine hits to little children,
Oh, yes.
little short
Yes.
videos. So we have to foster this happy relationship within families, community with other children. This is why we're doing this retreat in nature. So we got to give um, parents the tools that they need to create this positive environment, because obsessive moms like you and I are not going
Yes.
to create good fostering of health. So we gotta change that. I was telling you, I'm a disruptor. I throw out what doesn't work, and I try to incorporate things that they were not there for me. And they're there. So we want things to be natural. We don't want, to be working hard for health. Create those conditions and let the health happen.
I think, if this can really, and I want to get more into the up locker, how people can get it. I know it's on your website, forwardonics.com, your books. The up locker is available there as well. It was invented by Dr. Wilford Engelke.
Mhm, mhm.
How long ago was this?
Well, his first publication, 2006.
2006. So
It's
you went,
20 years around.
okay, and you went on this journey to find this device and incorporate this. This is now on your site, it says 12 and older. So is that, I mean, can it be used in small children? Like, are there different sizes? Or is there just pretty much one size? Are you like who's the
We have,
perfect person for
yeah,
this?
we have the passive flow. The 18 plus is basically the same device with the shape of a pacifier. And it really should be guided by a clinician. Legally, I have to say it's for a certain age. It can't be cut, so it's one size fits all.
And that is the one you're holding up right now. That's the up
Yeah,
locker for
yeah,
those
this is
watching on
all.
YouTube. Yeah.
Yeah, and we have the one you can disconnect and put a toy in between to make it fun. But really, we have so many amazing therapists in all over the world. In California, I work with Catherine Colachico. She, can guide families and children to use it properly in practice in a very gentle, inclusive way. The passive flow, it's the same shape, but it has the shape of a pacifier. It's not a pacifier that you can just give the baby, although with newborns, um, the moms can give it when they're asleep, but you have to watch the baby.
Okay.
And once they get to the teeth start coming in, then you move to one that's it's the same mechanism. It has a shield that goes between the lips and the teeth to keep that suction. So you can teach the children to maintain that reflex. So it can be used at any age. I do recommend working with either a marine-functional therapist or we work with an SLP, speech and language pathologist, Catherine. But the PT that I work with a lot out of Chicago, Jennifer Hobson, she's a savant teaching this stuff. So if anybody's interested, it's worth doing either a teleconsult or a real consult in person to get this done, because I find it's very useful for me and my patients, and we did that clinical trial, and we have a couple more studies coming up. We have one that's been submitted to the AJODO, which is the Q1 for orthodontics, and we found that the results orthodontically are tremendous using this device. So we worked with children, but the main thing that we found that blew everybody's mind is that deep sleep exploded with kids that learned to rest. And the key is to rest without using any energy. So we call it relaxed rest.
Hmm.
So it's not the same.
Effortless resting, just effortless. The body can do what it needs to do. The brain can do what it needs to do. It's disconnected
Yeah.
and it's just repairing and resting. Is this something you wear daytime for a little while and nighttime? Like, do you this in and go to sleep, or is this something you need to be awake and experiencing? How does somebody use it? How can practitioners also, question two, how do we get more practitioners understanding, is there training so that, they can help their patients with this?
Yeah, this is very um, organic in the way that our body knows how to use it. So it's very easy to learn and it's just repetitive. What we suggest, and this comes, it's published science in a medical journal, a very high level. It's not information or opinion publishing because there's different levels of publishing. But Dr. Engelke published in a medical journal, and he was working with snoring patients, and his protocol was 20 minutes of active wear before you go to sleep, and you try to distract yourself so you're not putting attention to it. So it's, if you're watching TV or you're doing something or reading, you put it in your mouth and you're holding that suction for 20 minutes, and then you go to sleep. We do have the lip locker, which can help you if you don't have the right shape and you're losing some of that um, suction. Then you can wear the lip locker, which is a very thin silicone covering that you put over your teeth, and it helps you hold that suction for longer periods when you're asleep. I was talking to one of my colleagues in Spain, and she sleeps with this, and she had 4 bicuspids removed plus the wisdom teeth, so her arch is super tiny, and she snores a lot. And she says she wears this, and her husband loves it. And she says, I know you don't recommend it for sleeping, but I sleep with it and it's amazing. And I'm going to continue sleeping with it for the rest of my life. So, people find out where they are, how it works for them. But the protocol is really 20 minutes before you go to sleep. For children, it's practicing while they watch TV. If they can do 20 minutes, 40 minutes, a full hour, the more the better when they're awake. And then it becomes second nature. And if you start before 2, within those 1,000 days of life, it just becomes natural. Like this baby, we're probably going to publish a lot of, it's one case, but Dr. Mew said one case doesn't prove anything, but it can explain everything. So we have our baby Zero now has such a tremendous corrected function and posture that we are able to show what's possible when you start early and you just foster those natural reflexes that are inherent in our species.
So to get the passive flow and the NutriFlow, is that also on forwardonics.com too? Okay, good. Okay,
Yeah,
so
I keep adding things and people think I'm just like, creating the store, but I just put there what I want for me and I make it available for other people. So it's all on our website.
well, let's dive into just a little bit on what you and I were talking about that you and I have both been through. Because this passion has been the universe, God, whatever you want to call this force, right, guiding us, it is definitely it has definitely been placed in my life to raise awareness. It's been placed in your life. And I come across a lot of parents that are on this journey with, craniofacial, dental facial orthopedics and airway health. And we all just kind of bond over this passion slash obsession. And for the person listening right now, it's important not to lose this family connection in all of this because you can get lost in the information. You can start feeling panicked with your kids. Ask me how I know. Something I'm noticing, I'm in a different season. My youngest is leaving for college in August, and I'm reflecting a lot. I'm 51. I'm looking back, and your kids have no problem telling you where all your deficits are, so they think they know everything. They're in their 20s and they're telling me, Mom, you were just, we appreciate things you did for us, but you were also, it was like mouth, close your mouth, nose breathing, myofunctional therapy, Buteyko, expansion, myofunctional devices. I mean, and I'm still trying to help them. What I love about what you're doing and what you said, there's such wisdom at where you and I are at in our life, having gone through all these things. So, for the parents listening, do not lose this connection. You're so bent on fixing problems with your kids that you can get lost in it and just just really soak them up and experience who they are. And I think it was like what you said earlier, just less is more. We want to get obstacles out of the way. The body knows what to do. I love the word promoting health versus preventing poor health. Promoting getting things out of the way. The body's conditioned to take care of itself. But what you're doing with this family retreat, if you will, because you've experienced a lot of what I have with it creates tension in your marriage. It creates tension in the family. I am watching now these young moms bringing their kids to my practice, and I see this little one sitting in the chair, and I am practitioner number 6 or 7 that they've brought. And sometimes they talk about their kids like they're not even there, and they'll talk to me in front of their children, and I'm going, I don't really think we should be. I'm like this. I just feel for the kid. I feel for the parent. I see the stress in the parent's face. So what would you say? You have all these things, right? And even on my ASAP, on this podcast, we have, all these things, myofunctional therapy, Buteyko breathing. We have, early orthodontic intervention. We have ear, nose, throat specialists. These are all real necessary things that form, function, neurology, gut health. You've got a mom listening right now, a dad, that is like, oh my gosh, I have all these problems. I snore, I have apnea, my dad has dementia. I don't want this life for my kid. Can you speak to them right now about something simple that they can just kind of go, it's going to be okay. I'm on the right path. I'm listening. I know that I need to help my kid, but kind of slow your roll and don't get overwhelmed and don't lose that beautiful relationship and the fun in your family. Can you speak to this a little bit?
This is lovely. I love that you brought this up as a closing point because we can't get some things back if we lose them. And the the bond, the family bond, the bond between your partner and your children, once it's broken, there's always PTSD there. So the retreat is great, and I'm going to tell you something. I've seen Dr. Rangel, which is the ENT that's going to be down there for the 5 days, interacting with his children. And this is when I decided I got to put children with this guy everywhere. He took a 4-year-old kid, and the parent brought her in, and I heard him talk to this kid, and I saw him do a rhinoscopy. He's going to have his rhinoscope at the retreat. But I saw him bend over and talk to the child and say, why did you bring your parents? What's wrong with them? Tell me what's wrong with your parents. Are they not doing anything? And the kid was looking at the parent, and the doctor was talking to the child. And he says that the child was expecting for the mom to complain, and the doctor didn't hear the mom, wanted to hear why the child had brought her parents. What was the problem of the parents? And the kid was just puzzled, but the kid started telling him, mom always tells me to close my mouth. And then he says, well, my mom complains about me eating with my mouth open. And he says, well, why don't you take a clothespin and put it on your mouth nose and ask her to eat with her mouth closed? And the kid just laughed. And the whole appointment was amazing. And then this kid let him put a tube down his nose, no anesthetic, nothing. And he was telling the child to look in the screen and saw his adenoid and saw how the mucosa inside was very dry. And said, you should oil it because it's dry. The mucosa inside your nose is trying to make water, and that's what your nose is running all the time. And he was talking to the child, and I'm like, this was so refreshing. And
Mm.
I think there's a single ENT in the US or anywhere else that I've known that actually talks to the child and gives the child the authority over his own body the way he did with 40-year-old. This is why this retreat happened, because I saw this happening. I said, we need more children going through this, and you can't do it in the US because of expense, because of the way, the medical system works and everybody's liability. And just to be there and have all the children be there and feed positiveness from each other, like a 5-year-old with a 4-year-old, with a baby, with a 10-year-old, with a 12-year-old, with a 13-year-old that's going through, the teens, having them all feed positively with each other. I mean, I'm very excited about this retreat. Nothing that I've ever done has excited me so much. And my team is crazy, going like, all you think about is this retreat. I said, yeah, because I want these families to have access to what I see that exists. So I was just passed this paper by my staff.
What does it say? Dr. Stacy. What does it say? Oh, it's in Spanish.
Yeah, so Dr. Stacy 5 is a coupon for discounts for you listeners.
Oh, okay. I'm like, what is this?
Because they told me telling her this. So giving you it's a code for a discount for anybody in the US that wants to go on our website. And they
Okay,
just
so how do it's I'm gonna put this in the podcast link. It's DRSTACY, the number five,
yeah, yeah.
and no space. Is it all caps?
No space, all caps.
Okay, all caps. Hold on, I'm writing this down. And the link to this is this is on your Instagram page, right? So I
Mhm.
might have you send me the direct link so I can put it in the podcast for this retreat. When is the retreat?
So the retreat, the first one we're doing is October 20 to 24th. So it's 4 nights, 5 days. And I hope to do more, but this is the first one. And we only take 20 families.
Wow.
So yeah, and we already have practitioners that are coming that are trying to get in, but we really want to make this an experience in nature. It's in the most fantastic place down in Mexico,
I
super
was gonna
safe.
say, where is it? Mexico.
Yeah,
Okay.
it's called Playa Viva. You guys can look it up. It's a eco resort it's a farm to table.
Mm.
There's tons of children there. We've done they do a lot of community work there. There's going to be art and activities and a lot of just incorporating this into daily routines that are fun for the families. So I'm very, very excited. And maybe you should come
I mean,
because
this would be, it sounds
yeah,
like a blast. I mean, this
yeah.
sounds like such a great experience. And I love how, you and I started off with, wow, this is a lot. And, there can be sometimes irreparable damage when you are just so focused on fix, 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 that you don't enjoy. You know, you've got to, you're on the right path. We know we want kids breathing through their noses. That's a given. We're working with ENTs. We know we need to develop the anatomy, get hiccups in, growth and development out of the way. Um, but you know what? A beautiful night's sleep does a whole lot more. So, I mean, the body is a healer. It's a self-healer.
Yeah.
And we just got to get the heck out of the way and let it do its job. And sleep is the way you do that. And I love that you're talking about sleep architecture in this study because we are all so obsessed with this AHI algorithm that really everyone's questioning is even the legit algorithm to look at, right? It's like,
It's not. It's
it's
not.
not. It's not.
And
So,
Ruby Knowles has said that, and Dr. Ron Hell, he's going to be also, he takes his polygraphs. So everybody that comes to retreat is going to have at least 4 nights of data because he's bringing the polygraphs.
oh, nice.
And says AHI is not to be looked at in children. It's the effort.
Yeah, and you have to look at the central nervous system and their sleep architecture. It
Yeah.
is get them in parasympathetic, and that is so amazing. This device is it's intriguing. It's amazing. I'm so glad you came on with me today. We'll probably have to have a part two with you because there's a lot more to say. You have amazing books and your patents and all your inventions. I thank you for being creative and bold. But I also appreciate and want to thank you for being vulnerable and authentic in this season of life, right? Where um, what I love about what you're saying is, hey, I'll be the first to tell you I gave up on something that no longer works. I tried it, it doesn't work. Some people have a hard time with that vulnerability. And, hey, I tried it, it doesn't work. Let's move on. Let's find out what is going to work. And so, it's a journey. Um, I always have 3 questions, Sandra, at the end of my podcast that have nothing to do with what we talked about, but they're just fun, crazy little questions. And then we'll let you go because I know you're super busy. Your team's probably sending you papers saying, "Get off the podcast, you have a patient." Okay, first, are you chocolate or vanilla fan?
Chocolate. Vanilla doesn't even exist in the universe.
You're like, "What's vanilla?"
Boring, boring.
Okay, what's the shortest answer possible? Like, what gives you motivation?
Um, I have no idea why I'm so driven. I have no idea. Um,
It's just there. You're just a motivated person.
well, I'm curious and I'm a problem solver. I always say to everyone, dentists should rule the world because a dentist is like the only profession that if you don't get rid of the problem, you don't get paid. Like if somebody comes in with a toothache and you work really, really hard, but the toothache's still there, you don't get paid. Every other profession, you keep going and they don't really fix the problem, but it gets a little bit better, but you have to pay them anyway, right?
All right,
And
we do
dentists,
fix so many
we
things.
have to be problem solvers. So I see anything and and now with my older kids, I have to stay back because I just heard a podcast and it says, your adult children don't want your advice. They just want you to be present.
Mm.
Even though you know how to fix their life, you got to just not say anything. And
Shoot,
I'm a
Sandra, I got to call my son and apologize for my entire yesterday then because I gave him so much advice and I hung up the phone. I thought, I'm working on it. I don't think he asked for it, but so yeah, your presence. That's
yeah,
really good.
my problem solver genetics, I think.
You got some good genes for that motivation, sister. And then, final question. Well, what's your favorite way to end your day? What's the ideal way that you would end your day?
Uh, I don't know, just laughing with friends, and I love playing dominoes, partners, and I love to win. And then, end
That's
of the day,
shocking.
yes, and then just cuddling up with my puppy dog.
Oh, that sounds like a beautiful way to end a day. I like it. Thank you. Thanks for everything you're doing, and thank you for being on today. And thank you, listener, for taking the time out to be with us today. And I'll put a bunch of links for all the things we talked about today. And hopefully, we have some families that just take a breath today and enjoy each other and know, all is well. It's going to be okay. You're on the right path, and just keep going, but enjoy.
I want to say thank you. You're a fantastic communicator.
Oh, thank you so much. I'm going to tell my kids you said that. All right, Sandra, thank you, everybody. We'll see you next time.
Have a nice weekend.
This podcast would not be possible without the inspiration of my dad, Daniel Becker, and creative direction and editing from the very talented Jason and Dane Becker, Ben, Lydia, and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And please remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice or to replace your healthcare provider's diagnosis or recommendations.